This exercise is called horizontal abduction. You're going to start with your light band to make sure you're tolerating this well after you've had that rotator cuff repair surgery. You're going to bring your arms straight out with your thumbs facing up. From here, you're going to slowly open your arms up while squeezing your shoulder blades in the back. So making sure you're pinching those shoulder blades or pulling those shoulder blades together, and then open that band up. We're going for about 8 to 10 repetitions here. One really important thing to note, and I see this happen a lot of times after patients have shoulder surgery, is we're making sure we're kind of engaging at our core and we're having good rib cage position. What I see it happen a lot with my patients after a shoulder injury is they tend to kind of lean back to try to get their back involved a little bit too much. So I want that core tight and I want that rotator cuff and those shoulders really working as we open up, making sure we're not leaning back with it. We're staying tight to the core as we open those hands up. Horizontal abduction, we're going for 2 to 3 sets, about 10 repetitions. This exercise is called a diagonal pattern with a band. We're again going to start with a light band here. This exercise is a little bit more functional than the horizontal abduction. Just kind of challenges those muscles on a slightly different plane. From here, you're going to start in that same position, thumbs up with our elbows straight. But this time we're going to kind of make a diagonal pattern in one direction, come back, and then make a diagonal pattern the other direction. Again, here we're trying to make sure that we are stable through our core and we're not leaning back. We're kind of staying straight up and down as we make those diagonal patterns. As you get better and better at this and that shoulder is starting to get looser and looser, start really challenging how high we're reaching that arm up. So as we get better and better, we're getting a little bit more vertical with our diagonal patterns. Okay. So early on, if you feel like you can only tolerate a little bit of elevation, that's okay. As you get better, start reaching higher and higher into those kind of elevation planes. Going for 2 to 3 sets, about 8 to 10 repetitions. This exercise is called a prone ITY. This is a great exercise to work on scapular stability. What you're going to do, if you have a physio ball like this, we're going to use the ball for this. If not, I'll show you how we can do it without a physio ball. So you're going to slowly lay on the ball with our chest down, slightly lift up here. The 3 motions that we're going to do are a capital letter Y with our thumbs facing up. So we're making a capital letter Y just to the height of our body, going for about 8 repetitions there. Then a capital letter T where our hands go straight out with our palms facing down. Just again, stopping at the height of our body, squeezing our shoulder blades as we go. And then a capital letter I, thumbs will be facing down, hands right to kind of where our sides are. Going for about 8 to 10 repetitions here, squeezing those shoulder blades back as we go. If you don't have a ball, we can do this without a ball. What you're going to do is you're going to lay on your stomach, and you can either put like a towel roll here, or you can really challenge your neck and kind of keep your head up just a touch. And this time we're just lifting about 2 inches up off the ground for those same letters. That prone I, then the T, and Y. I-T-Y. Going for about 2 to 3 rounds of about 10 to 12 repetitions. This exercise is called external rotation. What you're going to do is you're going to take your band and your doorway stopper, you're going to attach it about waist height in the door. You're also going to take a small towel roll and tuck it underneath the armpit of the working or the operative arm. This is a bread and butter exercise after a rotator cuff repair surgery because we're directly strengthening that rotator cuff. You're going to start with the band with your thumb facing up, hand kind of on your belly. From here, you're going to pull that shoulder blade back, tuck that shoulder blade back, and slowly open up that hand, externally rotating at the shoulder. I'm making sure I'm squeezing that towel roll down between my armpit as I open this hand up here. So I'm rotating straight out. A couple important things here as you're going, making sure that you're not dropping that hand down or raising that hand up. The hand stays in the same vertical plane the whole time. Second thing here is making sure as you're coming forward, that shoulder doesn't rotate back. It stays down and back the whole time that we're going. This is called external rotation. We're gonna go 2 to 3 rounds, about 10 to 12 repetitions here. This exercise is called internal rotation of the shoulder. You're gonna set up with the towel roll underneath the armpit of the working or the surgical arm. The band is going to be in your door with the doorway stopper attached at about waist height. From here, you're gonna start with your thumb up and you're going to turn your hand in until your hand touches your belly and then slow and controlled back open, letting it stretch you open as far as you feel comfortable. Turn straight back, hand to belly, and then back out. Making sure that as we're turning in, we're not rolling this shoulder forward, but we're kind of keeping the shoulder back, and we're just trying to get as much rotation as we can without compensation from our scapula. We're going for about 10 to 12 repetitions here, about 3 rounds through. This is called shoulder internal rotation.